you're sleeping next to someone you love and you don't even realize that they're unable to breathe. You can't protect your loved one even from just inches away. This is the reality of over 1 out of 5 Americans, the amount of people who suffer from sleep apnea. My name is Mansi Gandhi, and these are my colleagues,
Suhani Modi
and Zach Rogers.
And we present to you the task to end sudden death, treating a silent killer. Sleep apnea is intermittent cyclical cessation or reduction of air, with or without obstruction of the upper airway. Central sleep apnea, or CSA, is a breathing disorder due to abnormal neurocognitive patterns, which eventually leads to obstructive sleep apnea, or OSA. OSA is an increasingly common, chronic, sleep-related breathing disorder, which is characterized by the narrowing and obstruction of the upper airway. The key anatomical abnormalities present in those with OSA are the narrowing, collapsed, and crowded airways compromised by the pharyngeal structures of the soft palate and the craniofacial morphologies of the micrognathia, which is an undersized jaw, macroglossia, which is an enlarged tongue scalloping, and the enlargement of the neck circumference over 16 inches. This leads to progressive asphyxia, which is the deficiency of oxygen in the body due to the increasingly stimulating effort of breath against the collapsed airway. The physiological factors that contribute to obstructive sleep apnea include a high loop gain, which promotes airway collapse, an ineffective pharyngeal motor function, which decreases muscle responsiveness, and a high respiratory arousal threshold, which prevents stable breathing. Having any of these phenotypes of obstructive sleep apnea can be fatal if gone undiagnosed, and many of these anomalies are also risk factors of OSA. With the awareness of having obstructive sleep apnea and compliant treatment, we can reduce the risk of sudden cardiac death, in which the most common hours are at night, between 10 p.m. and 6 a.m. Next, my colleague Suhani will discuss the risk factors, treatment options, and diagnostic process of obstructive sleep apnea.
Thank you, Mansi. There are 3 types of situations in which the diagnosis of sleep apnea transpires. It can range from a routine health evaluation to an assessment of symptoms to a comprehensive evaluation for patients high at risk. Classic risk factors can make an individual more prone to sleep apnea, such as diabetes, obesity, age, craniofacial characteristics, and other underlying health issues. Obesity is the most prevalent risk of sleep apnea, and over 50% of those diagnosed with OSA have obesity. As well as this, different ethnicities can have different risk factors based on their craniofacial features, such as micrognathia and neck size. To be more specific, African Americans can be more prone to macroglossia, or enlargement of the tongue, which makes them more prone and have a higher chance of sleep apnea. As well as this, those of Asian descent can also have disadvantages, such as their hyoid being inferiorly positioned, as well as the fact is that their cranial base can be extended and shorter, giving them a higher chance of sleep apnea. African American children are 4 to 6 times more likely to have sleep apnea than a white child, and in general, under the age of 26, African Americans are 88% times more likely to have sleep apnea than a white person. Later in the presentation, my colleague Zach will discuss the impact directly of sleep apnea on different ethnic groups. Risk factors play a huge role in the diagnosis process. Symptoms of sleep apnea include tiredness, drowsiness, unexplainable fatigue, and snoring. The first primary step to diagnosis is the Stop-Bang questionnaire. The Stop-Bang questionnaire is an assessment tool that a physician uses to diagnose a patient with sleep apnea and to decide whether or not to use a polysomnography. The factors that the Stop-Bang questionnaire questions is snoring, tiredness, observed stop breathing, high blood pressure, a body index greater than 35, age older than 50, a neck size over 40 centimeters, and their gender being a male. For the general population, anything scored yes from the numbers 0 to 2 are low risk of sleep apnea. Anything scored from a 3 to 4 is an intermediate risk of sleep apnea, and anything from 5 to 8 is a high risk of sleep apnea. For those patients who score intermediate or high on their sleep apnea Stop-Bang questionnaire are then taken in for a polysomnography or an at-home sleep test. A polysomnography is a multimodal analysis that measures electroencephalograms and cardiorespiratory parameters, which detect apneas and hypopneas. The apnea-hypopnea index is a system of metric sleep that measures the number of apneas that occur during 1 night of sleep divided by the hours. Anything less than 5 is normal, 5 to 15 is mild, 15 to 30 is moderate, and anything greater than 30 denotes severe sleep apnea. An at-home sleep test is a simplified version of a polysomnography in which the patient would wear a device that would then tell their physician their blood pressure, their heart rate, breathing patterns, and their blood oxygen levels. If these tests come back abnormal, then there are a series of treatments that the patient can choose that both show surgical and non-surgical methods. The gold standard for treatment is the CPAP, which is the continuous positive airway pressure. This device is worn on top of the nose and the mouth at night, and the air pressure is greater than the surrounding air, therefore forcing the upper airways in the throat to expand, therefore preventing apneas. If a patient is non-compliant with a CPAP, there are also other devices such as an AutoPAP and a BiPAP that the patient may be able to use. As well as this, there are highly effective oral appliances in which the patient would wear at night, pushing their jaw forward, allowing their airways to open up, therefore preventing apneas. For severe cases of sleep apnea in which the CPAP and the oral appliance did not work, there is a surgical option called hypoglossal nerve stimulation, which focuses on the movement of the tongue and limits it so that the airways are able to open up. As we can see, treatments are very important, and a big part of treatment is patient compliance. Now I would like to hand it off to my colleague Zach, who will now discuss the results and challenges of patient compliance.
Thank you, Suhani. Compliance is a major part of the sleep apnea treatment plan. Around 90% of Americans with sleep apnea are undiagnosed. Whether they are diagnosed or not, a lot of patients prefer not to get treatment. This can be due for a plethora of reasons and fears that they may have. As Suhani said, the CPAP is a great method of treatment, but that doesn't always translate well to patient comfort. As you can imagine, the constant air being blown through the oral nasal region of the patient is going to cause their mouth and nose to become dry, causing great discomfort for said patient. This results in only a 65 to 70% acceptance rate amongst patients. The feeling of claustrophobia and a maddening noise is also reported amongst these same patients. Another reason why patients may not comply is due to the fear that their license may be revoked. This is a problem for both the patient as well as the people around them, as noncompliance with sleep apnea treatment plans results in an increase in fatigue, which is linked to an increase in accident probability. Other patients may not be able to afford treatment methods or doctor diagnoses because of their low economic and social statuses. Low socioeconomic status patients are more likely to be Medicaid and Medicare recipients, or just simply uninsured. For those patients under Medicare, they are not covered for dental, so therefore have less access to a medical professional to help diagnose and treat them. These same patients are less likely to seek health care, and if they do, it is for emergency reasons only. The problem isn't just with patients though, as medical professionals also fail to educate, diagnose, and treat those with this silent killer. Like I said earlier, this results in 90% of those with sleep apnea to be undiagnosed. What many fail to notice is that different ethnic disparities can lead to a change in patient compliance and treatment. These differences rarely, if ever, get addressed and need to have more attention drawn to them. Like Suhani touched on earlier, many different ethnic features that are associated with different ethnic backgrounds can lead to a change in patient compliance and treatment. These are many of the challenges that patients face when dealing with the compliance and treatment of OSA. Now, my colleague Monsi will discuss a solution that we have created to deal with this problem.
Thank you, Zach. In order to combat the misinformation and non-compliance of our OSA patients, our team has created a journal that promotes the positive mindset of our patients when dealing with obstructive sleep apnea. This journal allows our patients to find comfort because they're fully aware of the diagnosis that they have, including what sleep apnea truly is, treatment options that they will have, a stop bang questionnaire to share with their loved ones, why it's important to comply to treatment, mental health resources, emergency contacts and appointment reminders that they can input, a yearly habit tracker, and journaling pages for their mental health. Our goal with this journal is for it to be distributed at doctors' offices at the time of diagnosis for OSA patients not only to help them decide what treatment option would be best for them, but for this treatment option to become a daily habit. We hope that families never have to suffer seeing their loved ones gasping for air at night, unable to protect them from the silent killer. Thank you for your time. Let's spearhead our initiative of treating the silent killer together.